Delighted to have representatives from our Behavioral Health Division. This is a resolution proclaiming September this year as National Suicide Prevention Month in our county. It reads as follows. Whereas National Suicide Prevention Month is dedicated to the role everyone in our community can play in preventing suicide, and all community members are encouraged to know the signs, find the words, and reach out to someone they are concerned about. And whereas preventing suicide requires the efforts of many, from individual friends, families, neighbors, and coworkers, to government agencies, private businesses, and community organizations. And whereas suicide is a public health issue in our community, and each death by suicide directly impacts numerous family members, friends, coworkers, loved ones, and often the entire community. And whereas the County of San Luis Obispo is committed to promoting protective factors against suicide, such as access to effective behavioral health services and health care. And whereas suicide prevention requires a comprehensive, multi-level approach that encompasses strategies for prevention, earlier intervention, treatment, and postvention after a death has occurred. And whereas the County of San Luis Obispo's Behavioral Health Department and community partners conducted annual suicide prevention activities and programs to reach over 12,000 individuals in our fiscal year 23-24, and between the years of 2020 and 2023, these collaborative programs certified over 3,000 community members in mental health skills and through suicide prevention directive trainings curriculum such as mental health first aid and QPR, which stands for Question, Persuade, Refer. And whereas in fiscal year 23-24, Transitions Mental Health Association Central Coast Hotline received over 10,000 calls or texts requesting support or referral information for crisis intervention services. And whereas September is recognized across the United States as Suicide Prevention Month and provides the opportunity to educate our community about warning signs and how best to help those most in need. Now, therefore, be it resolved and ordered that the Board of Supervisors of the County of San Luis Obispo, State of California, does hereby proclaim September 2024 as Suicide Prevention Month throughout the County of San Luis Obispo and urges the community to act together to save lives.
Good morning. Thank you for having us here today. Handed out was mental health check-in kits, as well as a pin back button that promotes our suicide prevention language of tomorrow needs you. So you can wear that all year round. September was first declared as National Suicide Prevention Awareness Month in 2008. Since then, September has been a time to acknowledge those affected by suicide, raise awareness, and connect individuals who have suicidal ideation to treatment services. The CDC states that each year, more than 41,000 individuals die by suicide, leaving behind friends, family members to navigate the tragedy of their loss. Suicide is the 10th leading cause of death among adults in the US and the 2nd leading cause of death among people aged 10 to 24. In 2010, not long after the declaration of September as Suicide Prevention Month, California initiated a 3-year suicide prevention initiative for all Mental Health Services Act providers throughout the state. Through this initiative, regional and statewide networks were established, helping to strengthen local community prevention efforts through shared knowledge and consultation. San Luis Obispo County and Transitions Mental Health Association began implementing a strategic planning process with the many community partners that would provide a working foundation for the future, along with a clear mission and our council name, the Suicide Prevention Council of San Luis Obispo County. The council was established in 2014-2015, and to this date, the council has implemented strategic projects based on our local needs. Lost my spot. Focusing on outreach to adversely impacted populations like veterans, older adults, and the LGBTQ+ community. The council provides annual mental health forums promoting the power of storytelling to create safe spaces to learn and heal from challenges and loss related to mental health and suicide, During the past fiscal year, nearly 12,500 contacts were reached, with an estimated 2,000 unique participants in presentations, forums, events, and trainings. Many of these contacts occurring during our focused efforts in Suicide Prevention Month. To this day, we maintain a robust council who meet monthly, made up of our dedicated partners, Cal Poly Campus Health and Wellbeing, CenCal Health, our Central Coast Hotline, County Behavioral Health and Public Health, County Department of Social Services, Cuesta College Health Services, Family Care Network, Gala Pride and Diversity Center, Knowing You Matter, Lumina Alliance, Sierra Mental Wellness Group, Slow Hospice, Transitions Mental Health Association, the VA Vet Center, the Veteran Service Collaborative, Wilshire Health and Community Service, and our very dedicated volunteers. Most people involved in the council have a close connection to mental health and suicide, having lost a loved one to suicide or as an attempt survivor. This group is dedicated to discussing what some consider a taboo subject, with the hope that together we can save lives. And I invite you all to attend our last events of the month. This Friday, we have our virtual multi-county suicide prevention summit from 9 till 4:30. It's an annual summit with our keynote speaker, Kevin Hines, who will be sharing his experience of strength and hope after his suicide attempt off the Golden Gate Bridge, and many other panels and speaker experts on suicide prevention and screening. And lastly, on Saturday, September 28th, the National Alliance on Mental Illness will be hosting their Beautiful Minds Walk at Laguna Middle School from 9 till noon. And this event will offer a walk to raise awareness about mental illness, host speakers from the community, and have a resource fair including our County Behavioral Health Department and community-based resources. Thank you.
Thank you. Good morning. Thank you for inviting us here today, to the chair and our Board of Supervisors. As mentioned, September is a time for reflection in our county for suicide prevention awareness. My name is Dr. Christina Rajlal. I'm the Division Manager for Prevention and Outreach Services for the Behavioral Health Department, where our suicide prevention efforts for this county reside. I have worked in the realm of suicide prevention work now for many years, learning and navigating facts and myths regarding the effectiveness of suicide prevention work. There are some things that I know to be fact. The more we talk about suicide prevention strategies, the more effective we are in reducing suicide within our communities. Recently, the 988 National Lifeline published on their website that for every one person lost by suicide, that 316 people are considering suicide but choose not to kill themselves. I know that research says that with every suicide loss, the loss impacts on average 176 individuals that are touched by this loss. This does not take into account suicide that is lost due to a celebrity life, which has exponential impacts. Being touched by the loss of suicide increases risk factors for those who are touched. These are family, friends, and networks. I know this to be true because I have lost someone very close to me by suicide. But there is hope. There's a lot of hope in this county. There are many resources that the county provides. We provide many resources to the public in our outreach and engagement efforts. We also support and fund our 24/7 Central Coast Hotline at 1-800-783-0607 and the crisis text line feature, which you can text hello to at 741-741. There's also the national 988 number that you can call for help. We as a county provide suicide prevention outreach efforts throughout September, specifically in September, and we wear purple and teal proud because those are the colors that are represented in suicide prevention work. This past year, as mentioned with some of the numbers, we reached out to 11,260 individuals providing suicide prevention materials and another 218 through our Suicide Prevention Council. We provide training to our community and to our staff on recognizing the signs of suicide. From 2020 to present day, we've trained 929 citizens on mental health first aid and 2,403 on suicide prevention training through QPR, as mentioned. We partner with many and advocate at the state and national level. in suicide prevention work. Additionally, I encourage you to learn more about suicide prevention awareness. All events and resources are listed on our slocounty.ca.gov webpage, and you can check out more information on our Facebook and Instagram page. Thank you for your time today and your recognition, and I'm gonna close with Megan.
Good morning. I'm Megan Boaz Alvarez, the Clinical Director for Transitions Mental Health, and have the pleasure of co-chairing the Suicide Prevention Council along with Rita. I'm so happy to be here this morning and have this subject discussed in a public forum because we really look at suicide prevention as a public health issue, and it takes far more than just our mental health professionals to do suicide prevention work. And to have the biggest community impact, we really need our community members to be involved. So you might be wondering, well, I'm not a mental health professional. Is there really a role for me in this work? And the answer is yes. There's a role for each of us in this type of work, just in looking out for our own friends, family members, and community members. I'd like to share some words from Kelechi Ubozo's book. We've Been Too Patient, Voices of Radical Mental Health, because she really highlights how the people in our sphere can be our protective factors. And each of us has the opportunity to play that role for someone. So she writes about how her friends showed up when she was really struggling. She's a suicide attempt survivor and one of our speakers at one of our past suicide prevention summits. I've been here before when the sadness is so thick it can choke me, and I have terrifying thoughts swirling in my mind, trying to seduce me with an escape from my pain. It can be horrifying, especially because I am a suicide attempt survivor. Lately, I've reflected on my recovery and how I get through really difficult times like this past year. This time was different. This time I asked for help. When it was too scary to be alone in my head, I reached out. I'm lucky. I have a support system. I called my mom, my therapist, and my friends to let them know what was going on. This is how I showed up. I was honest and accountable, and I told my loved ones what was going on and that I needed their help and support. I didn't lie and pretend everything was okay when it wasn't. This time, I put my mental health first. And I think this next piece is really the piece that's key for all of us. This is how my friends showed up. When someone is physically sick, people know exactly what to say. They bring casseroles, they send flowers and cards, they make phone calls. They think about what somebody in pain might need. I don't think it should be any different for folks who are feeling suicidal. But I get it, it's scary. What do you say? What the heck do you do? How do you show up for someone who is going through darkness you may not understand? I don't know the answer for everyone, but this is how my friends showed up. When I was so depressed I couldn't get out of bed, my friends brought me groceries. My friends took me to poetry readings and hiking in the redwoods. They brought me to dance classes and karaoke, invited me to dinner, sent me inspirational texts featuring unicorns and vampires. One friend made sure we had a weekly walking date to check in on me and give me some physical activity. A friend in New York sent me an adult coloring book and some pencils. Some friends called, other friends sent emails or letters. None of these acts of kindness required a background in therapy, just plain old thoughtfulness and care, which any human is capable of doing. What I needed was connection. Nothing was too small to make a difference. I needed an interruption to the isolation and negative thoughts in my head. In the past, I pretended everything was okay while I secretly broke down, but this time was different. If we can create a world where the stigma of suicide is decreased so that people speak up when they need help and are in pain, maybe we can prevent anyone else from dying. And fighting this stigma in silence, well, that's how we can all show up. So we want to finish with that call to action, just to show up for our friends, family, and community members, because that's really something that any of us can do. Thank you.
Thank you. Thank you, ladies. I'm going to bring this back to the board for comments. Supervisor Gibson.
Thank you, Madam Chair. I just want to, first of all, thank all of those who work in this field and their extraordinary human compassion, and observe that over the course of maybe the last 10 or 15 years, a huge amount of progress has been made in bringing suicide out of the darkness, reducing stigma. And Dr. Rajlal, thank you for your, very pointed comments on that. It strikes me that with so many of our challenging issues, human issues here, the importance of community shines through here. And that to bring that message to the wider community is incredibly impactful and incredibly moving. So thank you all for doing that, and I wish you all success in increasing your efforts in decreasing the suicide rate. I appreciate it.
Supervisor Ortiz-Lake?
Yeah, well said, ladies. You had a really nice presentation this morning, and the materials that you're bringing us, all of these resources that are available, it really shows how collaborative you've become with throughout the community with all the different organizations that can find a way, and that, you know, I love that tomorrow needs you. I also love Know You Matter. And you are beautiful, you know, so today it all comes together, but thank you for your dedication. And I look forward to seeing you on Saturday. So thank you at the walk.
Supervisor Pashon?
Yeah, I wanted to thank you for I mean, you probably do one of the toughest jobs and under the toughest circumstances in San Luis Obispo County. And I was just, I'm perplexed by 10,000 calls that Transitions has had, which has to be the most probably in a year period or whatever's occurred. So, I mean, the problem obviously and the situation and the solution, things are getting worse. And so I think that by doing what you do, you are making a difference in people's lives. And we know that, and looking forward to hearing more about it on Friday.
Supervisor Paulding?
Yeah, thank you for the important work that you do. You know, I was struck by the comment that for every one suicide, there's 344, I think it was, people that aren't. And that does underscore the importance of the work and, you know, why our board has made mental health a top board priority, supporting the work that you do in the Behavioral Health Department. And I do want to also recognize that the theme today, it seems, you know, we talked about the importance of anti-hate efforts in our community, just being thoughtful and kind, and we heard acts of kindness, you know, in our history here in SLO County, and all of that adds together that if we can all step up and be better neighbors, good neighbors, you know, support our friends, our family, and our community, we can together, you know, affect the statistics in a positive way. So thank you again.
And I too want to add my thanks, and just the fact that you're here today and we're having this discussion in public will help people understand the resources that are available that you provide. So thanks so much for being here this morning.